My name is Liang, and I'm from the School of Public Health. And we are taking the opportunity of this COVID-19 pandemic to do some sharing between what's happened in Laos and what's happened in Singapore. There are several institutions participating here. From Singapore, we have the Souphatsone School of Public Health. We have a stellar cast of speakers, including Professor Alex Cook and our own Dean, Professor Teo. Then we have from Lao TPHI, Professor Sengchanh, the Institute Pasteur of Lao team, the University of Health Sciences team, as well as hopefully the National Center for Laboratory and Epidemiology. For those of you who have joined us, unfortunately, you're all muted except for the panelists. If they have any questions, please raise them in the chat, and then we will look out for them. It's quite a tight schedule, I think. So at first, we will have the introductory presentations by the different institutions' representatives. And then there will be 2 talks on the Lao experience and the Singapore experience, followed by a panelist discussion where the questions will be tackled. So without further ado, I'd like to start off by inviting Professor Sengchanh from the Lao TPHI Institute to give her opening address. Professor Sengchanh, please.
Okay, good afternoon. Did you hear me?
Yes, we can.
Okay, good afternoon, everybody. Thank you so much, Dr. Li Yang, to organize this kind of important web seminar. And thank you also, Professor Teo, that you could join, and Professor Alex, yes, Sabadi, everyone. And thank you also, Professor Wan and the IPL, that you join this seminar. I think this seminar is very important, as we already start discussion a year about collaboration, and then we would like to start to do something else important. And as we know that the COVID-19 is a pandemic and is a very deadly disease, and I'm glad that we can just come together.
Dr. Sengchanh, I believe you are now on mute.
Okay. I think it's work now. So
yes, it works now. Yes.
Okay.
It's good now, yes.
Okay, so we would like also to test if our students can join this time, and if they have some questions, and then they can raise their hand, and then they can ask the questions. And thank you so much, everyone. And I think the National Center for Epidemiology and Laboratory, Dr. Padit and his team could not come because he has a very urgent meeting with the MOH. So then he sent the slides that I can share with you later on about Lao experience. Whatever, I think others team from Lao science can also share something if I miss the point. And in this time, Professor Mai Phong also could not join because he have a very duty. He is some promotion in his university, so he could not join. But I am glad also the Institute Pasteur also could join, and then Sompavan, Dr. Anthony, and other team members will also share some of the works that happened in the IPL. And for this time, I think I would like to open our discussion, and glad and thank you so much for all who join, and also even if we have a technical problem, we apologize for that. And we do hope that we can learn with each other, and what support that we can give to each other on these collaborations. Thank you so much. And nice meeting all of you today. Thank you.
Thank you very much, Professor Sengchanh, for that very welcoming address. I think we're all getting used to Zoom and other forms of virtual communications. And yes, technical issues do crop up every now and then. I'd like to ask Professor Teo, Dean of the Souphatsone School of Public Health, to give a bit of an opening address. Professor Teo, if you do not mind.
Thanks very much, Professor Su. And thank you very much, Professor Sengchanh, for joining up via Zoom this exchange between the Souphatsone School of Public Health in Singapore, together with the Laos and Public Health Institute, as well as fellow colleagues in Laos. I think this is a good test for both sides because we've often talked a lot about educational exchanges. And I think this webinar, joint webinar, will be one of the first that we can conduct jointly. And it's always useful to have both our people experience and iron out some of the issues that Professor Su earlier on talked about. And I think that this time of COVID, what is very important is that education must continue. Especially education, tremendous in its effort to manage COVID-19. And I was checking earlier on, Laos currently have only 20 cases, so that's fantastic. Well done and keep it up. Singapore, we just passed the 50,000 mark, but the situation in the community, which is where a lot of the efforts are centered around, the situation in the community in Singapore remains under control, and the large numbers have unfortunately been amongst migrant workers that live in dormitories, and the way that they're living together does increase the speed as well as the magnitude of the spread. But also the good news seems to be that we are getting it under control, and the government actually announced that by the second week of August, we will be confident of clearing most of the infections within the dormitories. So that's certainly something we look forward to. But beyond COVID, I earlier on talked about education that must continue. And I think that one of the elements that have emerged very prominently during COVID-19 is the importance of academic and government partnership, because academia contains quite a lot of the science, the data, and ability to make use of this information to actually advocate the right policies for a country. And I believe that the Laos Tropical Public Health Institute, the National Public Health Institute, and other institutions in Laos similarly would play an important role in advising the government of Laos on what are the policy measures that will be necessary to continue this protection over the Laos people. In addition to academic government partnership, I think another element that I see to be very important, emphasized tremendously during this period, is really the global and regional exchanges, very much like what we have here around information, around data, and more importantly, around best practices of containing this situation. And I see this to be particularly important for Laos, Singapore, and other countries in Southeast Asia, for a very good reason that we share very similar cultures, and because of that, there are similar challenges as well. Some of the experience, if we share with countries in North America and in Europe, would be very different because the culture is completely different. But I see that between Laos, between Singapore, there are many similarities that I think both sides can learn from. Clearly, Singapore would be very keen to learn from Laos to find out how you have managed to keep your numbers to be as low as 20. And I look forward to the exchanges that we have today. So thank you very much for this opportunity. And I look forward to this afternoon's exchanges. Over back to you, Professor Su.
Thanks very much. Just Liang will do. We'll leave the professors to the real professors. And now, Professor Fed Savant, would you be prepared to say a few words on behalf of UHS? Over.
Okay, my microphone is turned on. Okay, nice to meet everybody. I think this is my first time to join you guys. So Dr. Mifong is busy today, so that's why I joined and I had to replace him. And we are also really interested in working with Singapore University, particularly in COVID-19. But previously, what I and particularly work on COVID-19 is we just create and the model, and because I am modeler, mathematical modeling to predict the outbreak and what is the intervention that could be the most effective intervention for Laos and to control the disease and to prevent the new outbreak. That's what we have been doing previously, and I think we submit the report to MOH, and we are working with Oxford University. And Professor Lisa Weiss, she is a mathematical modeler that it's a consortium on mathematical modeling on COVID-19. For the globally, there are many countries that join, and Laos is one of them. So, and in the future, I think we are really interested in doing many things else regarding the COVID. Thanks.
Thanks very much, Professor Fetsavan, and I'm glad to hear that you are a mathematical modeler. I think you would be the right person to critique Professor Cook's work that he's going to present later. Moving on, I don't think we have someone from the National Center for Laboratory and Epidemiology here, but I'd like to ask perhaps Dr. Souphatsone, would you like to say a few words about the Institute Pasteur of Laos? Because I think many of us from Singapore have not been to visit. Over.
Okay, good afternoon, everyone. Okay, I would like to present the team in here that we join this meeting. First, our Deputy Director, Dr. Damini, and also Nina Vilajit, she is responsible for the seroprevalence of the COVID-19, and also Elodie Carroll, she is the scientist in our lab. So for the pasteur, pasteur is the second line for the diagnostic of the COVID, but we hear about the COVID-19 outbreak in China, our team prepare the team and also the task for diagnostic the COVID. In around the February, we already set up everything. And also for our pasteur, we connect with the other institute pasteur in the Southeast Asia to sharing some information.
Thank you very much. I think there was a little bit of static, but I hope everybody heard you clearly. I realized that I'm wrong, and Dr. Souphatsone from the NCLE is here. I'm not sure I pronounced your name right, but would you mind then giving also a bit of a welcome address and talk us through what NCLE does, please? Over.
Souphatsone เว้าหยังบ่เนาะ
ไม่เราไม่ได้เปิด
Dr. Souphatsone, we can't hear you. Dr. Souphatsone, I'm sorry, you are not muted, but for some reason we can't seem to hear you.
Dr. Souphatsone should be able to speak now. I made him co-host.
Thank you. Dr. Souphatsone? Okay, Dr. Souphatsone, I think you have to unmute and then hopefully this will work now. My apologies. I'm not sure we can still hear you, Dr. Souphatsone. Maybe there's a problem with the speaker. Okay, we'll just give about a minute. I think, I'm not sure whether Dr. Souphatsone is logging in.
Hello, can you hear me?
Ah, that's very good. Hello again.
Yes, hello again. I'm sorry, I didn't have a technical problem with my laptop. I use the mobile phone to connect with you. First of all, I would like to apologize that Dr. Pandit cannot join the meeting. Happy to join the meeting, and this is my first time also for join the conference between Laos and Singapore. I hope that we can learn each other in terms of the COVID-19 control measures, and I also will present the slide from he's prepared. Thank you very much. Over to you.
Thank you very much, and I'm glad you were able to join us. So
Yes.
now we move over to the next part of the talk, which is the Lao experience with COVID-19. I think to start with, we would like to request Dr. Somphavan from Institute Pasteur Laos to share with us your experience. Over to you.
Good afternoon again. I would like to share our experience for COVID diagnostic in our Pasteur Institute with you all. And for as you know that the Pasteur Institute is the second line for the diagnostic of the COVID. So before the outbreak in the China, our team have been trained in BSL3 regularly. This is a photo that we trained in the cohort. During the outbreak in the China, our team know that there is the outbreak, so we prepare we prepare our team and also the technique. In the end of the January, we already finished our protocol for the RT-PCR for COVID-19. such as the Buri protocol and Hong Kong protocol. And also we already set up the team into two teams, and we can work 7 days in 24 hours. And then we also regularly meeting with the MOH, WHO, NCLE, Lombu, and Maria to separate the role of the working. And in our institute, we are responsible for the 10 hospitals, 7 for the Mary Hospital in provincial, and also the 3 hospitals in Sengchanh capital. But mainly we receive the sample from the Sengchanh Hospital. And this one, after that, we know about the role of the working. So we train the hospital how to correct the sample and how to use the PPE, and this one the photo for our training. And then for the IPL response, we for the hospital side, they will train on the appropriate specimen correction using the appropriate biosafety protocol, and also they should packing the sample and transport to the IPL by the IATA. And for our team, we separate into 2 teams, and one the senior virologist, she will responsible for our test, or she will check our team is okay or not. And then we have the 2 junior scientists and the 3 technicians and 1 military technician that join with us. And for our organization, that we will receive the sample at 8 a.m. until 18 p.m. 7 days. And if there are the urgent, we could come 24 hours. And then for the personal access the sample, we very strict. We should minimum of 1 junior scientist and 1 technician, and never alone in BSL3. And then for the, if there is the urgent, for our team could come. The working and career for our team, when the hospital have the suspected case, they will correct the sample, and then they will call to the IPL. So our team will bring the sample in the hospital, and then we transfer the sample to the BSL3, and we then use testing in there. And then if we got the result, we will report to the NCLE, and NCLE will do the certificate and will report to the MOH. And also for the first 20 negative sample and first 5 positive sample, NCLE will share the sample for us, and also they will send to the WHO lab to confirm again. And when we receive the sample, we will transfer our sample to the BSL3, and we will work in the BSC, not the Gulf box. But for our role is quite different with the NCLE. We will work at the BSL3, so we are the full PPE is different with the NCLE, because over there they work in the BSL2. And then we will look at the information and the sample is the same or not. And then if the same, we will record and keep in the BSL3. And then we sample in activate and extraction. And then we finish the extraction. We will bring the sample out and print it in the chemix room outside and do the PCR. And for our result, we will feedback to the NCLE and WHO, and then they will report to the MOH. And for the cluster, until now we received 226 sample, and we found 1 positive sample here. And the other is the NCLE that they do. And this one that the photo that we are working in BSL3, left side is that the technician is correct, and is I record the sample, and the right side our team is accepting the sample. For our institute, that we got many budget from the supporter, such as the Canada, they support us to purchase the PP and reagent for the COVID-19, and also the EU, they provide the 1,000 serology rapid test for us, and also the 1,000 surgical mask. And also the Rongbu, they support us to purchase the new equipment to increase our capacity to diagnostic the COVID-19, and also the French by the AFD, they support some fund for us to diagnostic the specific case, and also support to do the seroprevalence study. For that we have still have many challenges that now we are still remit about the extraction kit, because when the many countries have many cases, so it's difficult for us to.
Dr. Souphatsone, maybe you need to run the slideshow, and because we can only see the first slide. Sorry.
Oh, really? Okay.
Excuse me, do you see the slide presentations now?
It's not in presentation mode yet. We only see the first slide. Over.
Maybe stop sharing and start again.
Okay, that's great.
Okay, I will. Can you see it?
Yes, we can see everyone in very protective suits.
It's again on the yeah.
เพราะวันยังเทือสวรรค์ไฮวิวได้น้องคลิกบนนั้นทั้งติดมานะบนแม่นตัวนั้นตัวต่อไปขวามือบนจำเม็ดหันคลิก Hi ก็ถึง Hi presentation
Can you see it?
Yes, it's good.
So I will start again or not?
I think that's fine. In the interest of time, let's just continue from here because yeah.
And for the challenge for us that we still remit the kit extraction, and also remit about the person that could go inside the BSL3, and then it's still the big challenge for us that we should adapt the second technique in our institute. That's all for my presentation.
Thank you very much for sharing. And I'm sorry for the challenges that you faced with showing the slides earlier. Could I ask you to stop sharing the screen and then Dr. Souphatsone, if you have any slides, or will you just talk us through what your experience has been with the COVID-19 pandemic? Over. Dr. Souphatsone, I believe you have a set of slides as well. Dr. Souphatsone, are you?
Son, can you try? Does it work? Okay.
Okay, we can see the slides. That looks great. Dr. Souphatsone, if you use the laptop, we can't hear you. Maybe you have to. Okay, now we have 2 of you in the room. Let's hope this works then.
Hello, can you hear me? Sound like echo. Can you hear me?
Yes. I think if you have 2 Zoom going on in the same room, there will be that echoing effect. I don't know if there's any way around this though.
Okay.
You could try to mute one of your mics.
Maybe you mute the laptop and then you just use this one to talk, the phone to talk.
Me? Hello.
Souphatsone, cháu off.
Can you off the audio and the video from, well, off the audio from the laptop and use the phone for the audio?
I think Hello, can you hear me?
Yes, it's
Yes.
better now.
Yes, it's good.
But the slide that I prepared, I cannot control on my phone because on the laptop I can control, but on the phone I cannot. I don't know how to share also. This is my first time to use on.
เจ้าสามารถใช้คอมพิวเตอร์แล้วออฟเสียงมันเนาะแล้วใช้เสียงจากโทรศัพท์
ฮัลโหลเฮ็ดน้องเฮ็ดแล้วนะแต่ว่ามันโมได้โดยก็บ่เข้าใจกันมันฟ้องขึ้นมามิวในโฮสต์นะเพราะว่าโฮสต์มันเป็นตัวคอนโทรลหั่นบัดเวลาน้องเข้าไปแล้วบ่ได้นะ
ว่าแต่ว่าเจ้าสามารถใช้โทรศัพท์ในการนั้นเว้าได้นะครับเปิดคอมคือเก่าแต่ว่าบ่ต้องใช้เสียงในคอมนะเพราะมันจะปิดลำโพงนะเพราะมันจะเสียงมันจะ
เฮ็ดแล้วมูดในคอมแล้วก็เฮ็ดสไลด์แล้วก็สิเฮ็ดแบบนั้นแหละแต่มันบ่ได้บ่เข้าใจว่าเป็นหยังแม่น
น้องมีสไลด์
อาคารสั้นค่อยสิแชร์สไลด์สไลด์ตัวของดร.ปนเป็นยัง
โดย
แล้วค่อยสิแชร์กันสไลด์ให้แล้วเจ้าอธิบาย
โดยได้
Okay, I will share the slides and then he can present use from him there.
Okay, that sounds like a good solution.
Yeah, yes. I think that's better.
Okay, I'm sorry again for some technical problems for the Zoom meeting. I don't know why it's with my laptop. I also do have a Zoom meeting several times, but I don't have this kind of problem also, but sorry again. So let's start with the experience from the NCLE, because also from the returnee worker, also as you might know that there are some worker who work in Thailand. So during the lockdown in Thailand, so they have no job. They have to come back to their country. So we have to do, and the management, especially if we have to do the quarantines and also do the test. And you will see the number of the tests is very high. So next slide. For the content that you see that we have, yes, this one is show the number of the POE, the point of entry in Laos. We have also 24 ground crossings for international airport and one ASR. We also have the local POE and national POE point of entry. So next slide, please. The situation now, you may update it. We have 20 confirmed cases, but no death. And for the testing, the suspect is 1,466. Including returnee worker also. Returnee worker, we test only who has meet the case definition or they have the symptom. And the specimen that we collected from total that the returnee worker and also the general people such as the diplomat, also the student that study in abroad, we also collect it's 25 or roughly 26,000, you see. And the cumulative number of returnee workers in Laos is around 1,026. Next slide, please. This graph shows the epi curve of the confirmed case also, and also the control measure that Lao government also implemented. And you will see the first March. We also have the one of the important event, the national game in Sengchanh. So the government decided to close. Even still, we have, and the first detected cases on the March. So after that, we suspend all the social gathering. Even school closed, and also another thing, even another concert or a marathon runnings And you can see that we have 3 asymptomatic cases also was detected among the 20. Next slide, please. This one is also about what we are doing in POE. We also conduct the trainings in POE, also and health training in POE starting in March, all the traveler management in place. And we have the SOP for the POE management and provide the training also for another 9 provinces. And we all did the stimulation exercise training for the IPC measures, also for the health care workers or non-health care workers who might have to know. Next slide, please. In terms of laboratory capacity, in theory, of course, we do RT-PCR and also IPL and Lomlu and Christopher Miller, and we also expand to 4 provinces that we want them to reduce our burden in capital city. We expand the mobile PCR for all provincial hospitals. So next slide, please. For the multi-sectoral cooperation in management returning worker. Next slide. So this flow chart show the coordination structure from the lower level, from the village level. We also communicate with the provincial committee, and each level they have the task force committee also to manage and about the COVID-19 events. So next slide. So the multi-sectoral cooperation management returning worker, as I mentioned early on, we closed this school during 20 March to 2nd of June, and the provincial committee coordinate with all sectors. And schools were used to some province, they use school to quarantines. And for the transportation from POE to the quarantine facility was provided by military and transport sector. And also the public sector ensure the safety and security quarantine facilities. Of course, we have to be safe during transport, the returning workers, and the family also bring food for the returning and some support by the private sector. As you know that we have lots of expense for returning worker also who have to do the quarantines at the government state quarantine. That means the government subsidize also, but some private sector also pay and support the financials. And the health sector is responsible for the health monitoring and manage all the ill people. And we also have the bilateral cooperation between Laos and Thai government in terms of the concentration capacity of the quarantine in Laos also. Next slide. For the multi-cooperation, and school no longer available, that they are closed to be the government facility, and some guest house and dormitory or training center open to be also the quarantine center for the government, and hotel also were used to quarantines. And the quarantine facility are far from the village. So it means the family cannot bring their food. And the quarantine facility is quickly filled. And as I mentioned earlier, that the government provide foods for the returning workers. Okay, next slide. These figures show that They also the community infection, community quarantine. Also, how we manage if they have suspected case, where we gonna replace and take him to that place. As you see that from the point of entry, we transfer suspected case to the isolation facility. If they have some symptom, such as fever, cough, sneeze, they will transfer to the hospital to collect the sample and test it for COVID-19. If they not, they can return to the government facility quarantines. So, okay, next slide, please. Also, we also implement the community engagement early detection, especially for the event-based surveillance. We now we train the village chief and also village health volunteer. Village health volunteer means the people who have the basic knowledge of the health information, so they can report if they have any cluster of the flus or any suspected case of COVID. And also, you might see on the right picture is a monk, is a leader of Buddhist religious. We also call the corporation to report the cases, suspected cases also. And we provide training now for the whole nation for the community surveillance. And right now, the Vientiane capital, it's starting to report the number of events or number of clusters that if they detect it, they will report to our network surveillance. Next slide, please. This is the experiencing of in Souphatsone. They do the community engagements or community surveillance. They quarantine for 14 days. As you might know, that I also explained, it might be the high burden, especially for the expense, the money. The government have to subsidize and pay for returning workers. So they changed to self-quarantine in the village with the support of the village headman, and as you know, health center and also village health volunteer to report if they have the symptom, so they can report to our network. And also community hand engage and coordinate between the province, district, local authorities. Also, we provide some necessary things, like a phone card for the village headman or village health volunteer to report us if there any person who have a symptom. So next slide. So this is the experience in Vientiane capital. As you know, that the returning workers come from Thailand, and we have in Vientiane capital, they allowed returning worker work run as ASEAN Stadium dormitory, and we also coordinate with another sector to support us, especially military, transport the returning worker, and also guard and keep an eye on the facility, government facility. And we also develop the standard and assessment tool for quarantine facility to multi-sectoral sector. And several UN agencies and NGO also join visit the facility. And we are now planning to roll out joint assessment and improvement support to other provinces also. Next slide, please. This is a joint quarantine center assessment improve support. That facility also infrastructure, screening, health check, zoning, and room and toilet and shower. If the necessary thing that we can cover, we try to do our best. This picture also we collect the sample from every facility and also some hotel that our team can do. Next slide. Here is some of the challenges and difficulty that we are having now. The quarantine capacity and transportation in country is reopening now. And for the operational cost for 14-day facility quarantine become higher burden, as I mentioned earlier. And the compliance on the physical distancing at the quarantine facility and public. It's still challenging because during collect the sample, also process another activity, they cannot do some facility, especially for the physical distancing that we are promote now. And also public health capacity at the POE and SOP for the IHR implement also. And for the testing capacity, of course, now our current policy is test for all the person who entering the country. We have to collect the sample, but we are not sure that our reagent might be run out, so we have to find another solution for to save our reagents. And community engagement is not the place to out the country yet. As I mentioned early on, it's just only start in Vientiane, but the training, we all train all the nationwide. And the national response capacity in case of reintroduction into the country, still we have to consider. So the way forward that we are planning to do, of course, the first thing that I mentioned earlier is to promote the community engagement, early detection, scaling up, monitoring capacity to be rolled out to other countries. And that mentioned that we don't have any insufficient staff if they have the huge outbreak or lots of number of cases, a lot number of close contact that we have to deal with. As you may compare with the healthcare worker in Laos, we cannot follow all the close contact and number of confirmed cases. So we consider sampling and testing strategy based on testing capacity in the country. As I mentioned earlier, still now we have a lot of returning workers and also a newcomer, a person who would like to come back to Laos. So we have to test more, and we worry about the reagents now. And as I mentioned, we will expand the lab capacity now. And now I think we will complete at the next month. We're gonna complete all the mobile PCR and everything to be set up. And another thing that we try to promote and implement is a new normal concept, especially physical distancing. It's not every office, and also another place like a market or bus station, we try them to do the physical distancing. And also last thing that we try to strengthen in national response capacity to the response COVID-19 based on national plan to COVID-19 response. In order for the future, we have the plan and the capacity to deal with the COVID-19. I think that's all for me. Thank you very much for your attention. If you have any question, please ask me.
Thank you very much, Dr. Souphatsone. I'm glad we got a chance to see the slides and listen to your very impressive presentation, which showed us a lot about what's happening in Laos. We're a bit over time, So I'd like to ask my colleague, Professor Cook, to present. I've asked him to shorten his presentation. So let's see what he can do. Over to you, Alex.
Okay, thank you. Unmute myself. So I'm going to try to be short as I can. And I'll cut out some slides. I'll skip past some as we go along. So I'm going to be telling you a little bit about Singapore's public health response, and then, depending on time, a little bit about some of the research that is ongoing in Singapore. I'm going to give you 3 facts about the outbreak so far. So as our Dean mentioned, we have had over 50,000 cases so far. I would guess maybe quadruple that number, so maybe 200,000 infections, but it's just based on guesswork. But we have had just under 30 deaths so far. This seems very discordant. Why would we have so few deaths given the infection fatality rate that has been estimated from other countries? Well, one of the main reasons is that the vast majority of our cases come from foreign workers who are mostly young men in their 30s and therefore at low risk of getting a severe infection. And I'll talk a little bit about that over the next few slides. So many countries have been asking about second waves and the risk of having a second wave. Singapore, in my view, has already had 3 waves of infection. We had a first wave early in the year, so soon after Chinese New Year, imported cases from Wuhan in China, together with some local cases who were infected by them or by their contacts. So that's the orange circle. We had a second wave, which was mostly returning Singaporeans coming back from Europe or America, and then sparking off local infections in the community. Our third wave is amongst foreign workers who mostly live in dormitories. And if you look at the scale on the y-axis of these charts, you can see that the foreign workers, like I mentioned, they constitute the vast majority of the infections that we have seen so far. In fact, today is still somewhere around about 90–95% of our cases are amongst foreign workers. So what is going on with the foreign workers? We have, actually there's not that many Singaporeans in Singapore. I think that of the population of 5.5 million, maybe only 4 million or so are Singapore citizens or permanent residents. There's a large number of foreign workers in the country. Now, many of the low-income foreign workers live in dormitories because it's cheaper. They can save money to take more money back home to their home country. And we have around about 40 dormitories, which look like the one on the picture there. These are purpose-built dormitories. We also have a large number of informal dormitories. These might be factories which have been converted, or some of their space being converted into housing for foreign workers. Typically, the foreign workers in these dorms would live 10 men to a room. They would share toilets, at least within the room, and possibly several rooms within the same floor. And what we're seeing in many of these purpose-built dormitories is that the clinical attack rate is around about 20–30%. However, seroprevalence, when we've gone in to take blood samples, has been much higher. So for some dorms, it's over 60% of the workers have been infected, according to serology. However, we have seen extremely low utilization of ICU for these workers. So some of them are requiring hospitalization, but actually very few of them are severe enough that they need to get like a respirator or something. And we have had almost no deaths. I think it's less than 5 deaths in the foreign workers so far. Now, the chart that I showed you before has a gray area. This corresponds to the period of lockdown, which in Singapore we called circuit breaker. So during the lockdown period, schools were closed, Most workplaces were closed. Obviously, hospitals, etc., stayed open. So essential workers were still going to work, but most people were working from home instead of working in the office. Most shops were closed, and a variety of other restrictions were placed on the population. Now, the effect of this you can see through the chart that I'm presenting here by one of my colleagues, Jemima. So the period in orange was the period of lockdown, and you can see how during that period people spent about 40% more time at home than they would have during normal times, and around about 60% less time at work or in transport than they would during normal times. As we moved out of lockdown into phase 1 and phase 2, you can see how these have gradually been going back to a normal level, so around about 0, so baseline. However, what is notable is that throughout the epidemic in Singapore, the reproduction number has almost never been above 1. So the epidemic has not really been self-sustaining in the general community. It's only really been imported cases and then the foreign workers which have been driving up the numbers of infections that we see. So what are some of the public health measures that we have in place? I'm not sure how they compare to the Laos measures. Laos measures seem really comprehensive. So we have, as I mentioned, school closure was in place, although schools have reopened now. Workplaces are, for many workplaces, they're still closed, and people are mostly working from home, coming into work if they have to. So for example, in the university, we're working at somewhere around about maybe 25% capacity. Mask wearing has become obligatory, so people must wear a mask. There were some it was very difficult to get paper masks earlier on in the pandemic, so the government has provided cloth masks for everyone, and you can get cloth masks at vending machines now. When you go into a shop, a restaurant, or an office, or many other places, you're required to scan in. You can see the people in the top right corner are taking photographs of a QR code to log where they're going in and going out. In the bottom left, you can see an app which has been developed and is used by maybe a quarter of the population, which detects contact between other people with the app and is used to try to make contact tracing faster. And in many locations, like our food courts, we have spaced out individuals. So you can see the table that man is sitting at. Some of the chairs have been marked off and people are not allowed to sit at those chairs. All of this is being reinforced by fines. If you've been to Singapore, you see we have fines everywhere. So over 5,000 people have been fined so far for breaching safe distancing measures. 1,000 people have been fined for not wearing a mask in public. We've had almost 100,000 people on stay-home notices. So they were the contact of a case and then were put in a stay-home notice. So for quarantine and isolation, our contacts are traced through a combination of traditional shoe-leather epidemiology, so officers from MOH and the police calling up cases to find out who they came into contact with, and technology, as I mentioned before, the app which is installed on phones. Contacts are quarantined at home, cases, usually at home, cases are isolated at a hospital or some new facilities which have been created to ensure there's enough space. So for example, in the picture there, this is usually an expo hall and it has been converted into a quarantine facility, isolation facility. And arrivals from overseas have been quarantined. Now, the location for the quarantine has changed over time. At the beginning of the outbreak, they were being quarantined at home. But then when we had our second wave, this was mostly because of people being quarantined at home, infecting others around about them. So then they were being quarantined in hotels or other facilities. But I think increasingly, we don't have many people arriving in the country anymore, but those who do are seen to be quarantined at home instead. I'm going to talk very briefly about research and whether the researchers in Singapore are having a good pandemic or not. I checked this morning, there have been about 700 publications from Singapore on COVID on PubMed. And in fact, Singapore has published about half of the papers from ASEAN. So in that sense, Singapore has been having a very good pandemic research-wise. Now, I think there's a few factors behind this. One, not all of these papers are actually really about COVID. Many of them are papers from, for example, surgeons talking about the impact of the pandemic on their surgery practices. And so many of these would not really be considered a COVID paper. They're more impact of COVID on other things. But I think that the other factor is that the resources run by the country have been going into overdrive to try to help facilitate our research. So IRBs have been working overtime to try to approve studies. So one of the hospital IRBs has been able to shorten down the period of time, at least for earlier studies, to tremendously compared to normal times. There's also been a strong kind of rally around the flag effect, where the research community has been working very closely together to try to help each other out to make our research more effective. So for example, we have weekly meetings with our National Center for Infectious Diseases where people will present their problems or what solutions they have to other people's problems. There's also, Singapore is quite a rich country, so we have been pouring quite a lot of investment into trying to help with the pandemic. So early on, because we were one of the first countries to be affected outside of China, so early on, we identified key areas for investment in research, and we're very quick to put money into these. So since, for the last few months, all of my team has been paid from a grant to do COVID research, for example. Now, these are reasons for which I think that we've been having a good pandemic research-wise. However, there's reasons why I would say that we've been having still a bad pandemic. A lot of other research has ground to a halt because, for example, field work was considered to be too dangerous for a while, and therefore our research teams wouldn't be going out door to door to collect data because it was considered dangerous because of the high number of cases. IRBs have been working overtime on COVID projects, but I think that they have been struggling with some non-COVID projects. I know that my own research on other diseases has become much slower because, like I mentioned, my team is refocused on COVID. There are other problems, such as when schools are closed, then someone's got to stay at home to look after the kids. And so researchers with families have been complaining about how difficult it is to get on with their work when they're also trying to supervise their children's homeschooling. So I was given up until 3:40 or 2:40. So I'll stop here, and then I think we can move on to the panel discussion. Thank you.
Thanks very much, Alex. That's very illuminating, and it's always interesting to learn things about Singapore from you. So we have concluded the first round of presentations. I see that there are no questions from the chat, but Professor Sengchanh and our other Lao colleagues, do you have any questions that you would like to ask over?
So I have no questions, but I am very glad to hear and see a lot of paper published on the research community in Singapore, and also the excellent application that I mean that you can have like you can catch up all the things that happen in the community that you show, Professor Alex, is very good data that you show us. And but I think that they have some anything else affected from the COVID. For example, in Laos, we have a problem with the immunization, because at that time during the COVID lockdown, and then the team could not go outreach, and then they have a problem with the immunization. So I don't know. I think it's happened here in Laos, in Vietnam, and in some Cambodia, but I don't know how how over there.
Yeah, so maybe I'll try to answer that question. So the impacts on other forms of health we don't know what that's going to be yet. It seems like some of the pediatric vaccination rates may have gone down. And I would expect that a lot of other operations have also gone down. I think elective surgeries, they've been mostly postponed. And so the impacts of that on health in the long term is not really very clear. So one of the projects that one of my colleagues, Hui Lin, is working on is to try to quantify what is the other impacts of the COVID pandemic on other forms of health. But we don't know the answers to that yet.
Okay, thank you. I think it's similar thing in Vientiane. You know, on the first week of we lockdown, and even in the pediatric ward, pediatric hospital, there was no patient coming. Actually, every day they have full children waiting for the OPD, and then suddenly just stop, no patients coming, you know, and then people also, I don't know, maybe too scared to coming to the hospital. And then 1 month later, and then it's fixed, and then people can come and visit the hospital normally. This is the first what we observed during the lockdown.
Yes, it's the same in Singapore, and because vaccinations were not considered an essential service for a few months, the Ministry of Health also inspects the clinics to make sure that they don't do non-essential things. Our vaccination rates went down. But Alex, there's a question for you. In Singapore, what is the policy for shielding of vulnerable individuals? Over.
Yeah, it's a good question. I don't think we have a particular policy about shielding high-risk individuals. It seems like all of the interventions that we have in place are meant to shield the population as a whole. I don't think that we have the same shield, like my uncle in the UK, he's shielding, and you know, he's not left the house for I don't know how many months. And I don't think that has been the case here. Leanne?
I think the only place has been in our nursing homes and our community hospitals, where the visitors were banned for several months, and only now they have started to allow 1 or 2 visitors masked to go in to see them.
Yeah. Although maybe I should add that one of the other forms of shielding is kind of strange from an external perspective, is that one of the reasons why we have had so few deaths or ICU admissions in our foreign workers is because very early on in the foreign worker outbreaks, we tried to move older foreign workers out of the dorms. So foreign workers aged 45 or over were preferentially taken out and put into other locations to keep them safe from infection. And I think that, I mean, it's kind of disastrous, the number of cases that we've had in our foreign workers, but that was one saving grace that really prevented a lot of bad impacts.
I think we have a question for our Lao colleagues. And one of the things that we have always wondered was, how was the number of cases so low in Laos? Because you have a large number of workers from China. And so at the start of the outbreak, we expected the case count to be high. So we wondered, is it a matter that of less testing, for instance, or you were lucky and they passed you by, or because everyone was young and they only had mild infections? Like, what happened in Singapore, so they didn't show up in your clinics? Over.
So I think most of the workers from China, they return home during the New Year. Actually, most of them return home during the New Year time. Yeah, and so I actually based on the number of testing, 25,000 something. I think it is a lot already. I feel that we do a lot of testing already. But remember, their own clothes on the market everywhere where the Chinese people living, they close because they return home for the New Year at that time. And they're also scared. If something happened to them, they might not find any good, I don't know, maybe hospital this kind of thing maybe. So then why we don't have any foul cases from China at all? Actually, the import case, 20 people is from other countries, but not from China case. Souphatsone, you have anything to add?
I think I totally agree with your comments also. I think we and for the Chinese, they return home and return to Laos to work. Also, they do the test. And before they come, they have to do the quarantine for 14 days. And after that, they have to test it. And when they come to Laos, they have to also test it and do the 14 quarantine also. I think we are not for lucky also, but we do in the systematic way and the standard way for the nation, for the all nation that we did also.
Thank you. It's remarkable. I think some of us would trade our 50,000 cases and 700 papers for the number of cases that you have and much fewer papers. I think there's a question by Dr. Black for Dr. Fatsavan, and that's about population density. Does that account for the differences in cases in Laos and Singapore? Over.
Well, in Singapore, with the most infections are our foreign worker dormitories, where we have, like I mentioned, 10 men to a room. So the really high population density. Within one block, you could have thousands of men there. And so I think that's one of the reasons why we've not been able to control the outbreaks there, simply because of the high density.
Dr. Fatsavan, would you have anything to add?
Yeah. Yes, I agree. Then population density is a main factor, and because of that, we can say the transmission rate, it's different from one country to another because of population density. And in the model that we predict, the transmission rate in Laos is quite low as well compared to UK, for example. And if we compare to the province in Thailand, for example, Nong Khai, and it's just the border where we have the same and population density, for example, Nong Khai and Udon, the number of cases is similar. And Udon, I think they also have less than 20 cases, where the population density is very similar to Vientiane capital. And I think this is already explained why we have quite low. We cannot compare to Bangkok or Singapore because the population density is completely different. And also the type of transportation and etc. There are other factors that's different. But if we compare something similar to Vientiane capital, it's more the province of Thailand along the border, and we are far that we're quite similar.
Thank you very much. I think we would like to end on time. So we have about 10 over minutes left. And I'll just like to ask the panel to answer one question in a few words or a few sentences. And that is, how do you think that Laos and Singapore or our institutions can work together for public health response, whether it's for COVID-19 or towards more public health efforts in the future? I'd like to go in reverse order, if you don't mind. So we'll start with Dr. Souphatsone, and then we will end with Professor Teo and Professor Sengchanh. So Dr. Souphatsone, in your mind, how do you think we can work better together? Over.
Okay, thank you very much, Doctor. And I think it's very, as you know, today is a globalization, and the disease can transport everywhere in the world. So cooperation is the main things, the crucial thing that we have to do on and exchange some knowledge together. And I think it's a very great honor for NCLE and MOS also to work with you guys. And Singapore, of course, they have the high technology. And as you show us the application, tracking people, it's also things that the Lao we don't have. So we exchange the new things we will learn from you also the new thing. And another thing that we don't have, another thing that you don't have, we can share our experience. Thank you very much for organizing this webinar for us. And I do hope in the future we can talk about our cooperation between MOH, Singapore and Laos. Thank you.
Thank you very much. Dr. Somphavan, how about from the Institute Pasteur of Laos? Do you have any comments?
For our pastor, I think that we can, because we do the research, or maybe we can share some information or some technique, because for now Lao scientists is ongoing to learn many things from the other, so I think we can share some technique for the laboratory.
Thank you. That will be very useful. Alex, Professor Cook is also the Vice Dean of Research, and he sits on the committee that kind of oversees COVID-19 research in Singapore.
So I think one of the possibilities would be on technology. So I mentioned that there's some apps that have been developed nationally in Singapore, and it's not as long as there is sufficient mobile phone penetration in Laos, which I believe there is, then those apps would probably work in a Lao context. So that would be one possibility. Although, to be quite honest, you guys are really in control of your epidemic in a way that we're not. So I'm not sure if the apps will help you that much.
Thank you. Professor Phet Savan, you're also a mathematical modeler. Is there anything from the UHS perspective or anything you would like to recommend? Over.
For recommendation, not particularly, but we from our side for Lao, actually we just preparing the model that we can, if there is any update data that we can put on, and then we can run the model differently, and we can run model again if we have the second wave. I think we are for Lao. I think we have a monitoring for second wave, and if we have any data that we can keep predicting what's going to happen next for Lao. But do you also have the modeling team for Singapore, right? Yeah, and
that's right.
Okay.
Alex, do you want to answer that, Alex?
Yeah. So we have a group in the school who do modeling, and so we've been helping our Ministry of Health develop models about the policies that they might implement, and creating a few different web tools. They've mostly been used for Singapore itself, although we have also shared some of the models with WHO for use in Yemen, and ADB for the Philippines. Happy to have a further conversation about that. If you wish.
Yeah, we can because we like to compare also as no model is perfect. That's why we will also would like to compare the model one to another, and what's gonna do next for particularly in Laos that we have really few cases and it's difficult to fit the model, and maybe we can share and then etc.
Yeah, you have too few cases. You should get someone to import some so that you can get a model.
Thanks very much. Professor Sengchanh, would you have any remarks and comments on how we can all work together? Over.
Actually, we already start to work something now on the research, even though I think I would like to say thank you to Dr. Li Yang that you connect us to the team of the research there. So then we also start to do something together already. So I think we can further continue this collaboration. I think one research is now going on, but very sadly that we have very few people on the online answering the question, but we try to do our best how we can get more response to that. And then the second, I think the second research that we are working now on the immunization, I think response. And yeah, I think further we can discuss more how we can collaborate. But I think I like the idea about the application and others technology that is very important there, but we don't have here. So I think Pesavan, we work more on the modeling, and then we can just have this sharing the data. And on the IPL, also I think we will work with the IPL together on the zero prevalence study. Then later on we can share what about is happening in Laos and what we can compare in Singapore or what else. I think for just now. Thank you, Maria.
Thank you very much. And we come to Professor Teo. Maybe just comments about working together as well as some closing remarks before we let Professor Sengchanh close this. Over.
Thanks very much, Liang. So I think one area that we can definitely look at jointly, it's around how do we set priorities as a country. And regardless of whether it is a country with more resources like Singapore or a country that is on its way to procure more resources like Laos, the issue has always been, if I have a limited set of resources, how do I prioritize this? And COVID-19 actually brings this to a greater degree of importance, because clearly when we start to see populations that need treatment, how do you decide that I should save some of my medical equipment, my hospital wards for certain groups of people? How do we set the priorities? And I see that this goes a little bit beyond COVID as well, that even during peacetime, priority setting in health and healthcare would be of great importance for any country to work on jointly. And I know that Professor Mei Fong, it has already been discussion with the school around issues such as health technology assessment. But beyond that, it is also a way of deciding between infectious diseases, chronic conditions, aging populations, vaccinations. How do we decide on what are the priorities to focus on? And I see that to be one area that both Singapore and Laos will have a lot to learn from each other, as well as a lot to offer. So I will stop there, but thank you very much again for this opportunity for the two countries, not just two sites, but two countries to really come together and look at issues around health and healthcare. Over back to you, Liang.
Thank you very much. That's a very nice closing from our side. Thank you, Prof. Teo, as always. Professor Sengchanh, would you like to say a few words before we end this seminar? Over.
Yes, I would like to say thank you to everyone who joined our discussion today, and very useful information that we get from everyone. And I wish all success and fighting with the COVID-19. And I would like to say thank you, Dr. Li Yang, for coordinating all the things of this. Thank you so much.
Thank you. And thank you for all of those who have joined in, especially to the Singapore side, whom I gave the wrong timing earlier. Stay safe and take care.
Okay.
Bye-bye.
Bye-bye. Take care.
Bye-bye.
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 Bye-bye.